Thousands of Manitoba patients are leaving emergency departments before they're even seen by a doctor. The reason they're walking out? They're waiting too long. A new national report shows the number of patients giving up in hospital waiting rooms is now well above the national average. That story tonight from CTV's Jeff Keele.
A couple of weeks ago, Mona Turcotte's relative was feeling faint, so she came to the emergency room at Health Sciences Centre.
And then she was put in the waiting room, and she was waiting and waiting until she was not feeling well anymore.
The wait was too much for her family member. She gave up and went home without seeing someone.
It's not fair to be ill and not be able to get the help that you need when you need it.
It appears she isn't alone. The Montreal Economic Institute, a public policy think tank, says it gathered records from provinces and health authorities and found in 2024 there were 456,000 patient visits to Manitoba ERs. Of those, more than 60,000 walked away without receiving treatment, or 13.2%, higher than the national average of 7.8%.
The situation is worse in Manitoba than the national average.
The Institute says this is an issue across the country. The demand for health care is growing because of a growing and aging population.
A larger proportion of the population needs health care, as well as struggles, increasing struggles to get access to care, primary care being one of them, and also the shortage of healthcare workers.
The research did show the majority of those leaving the ER are considered semi or non-urgent cases, but patients often return to the ER because the symptoms get worse when left untreated. That's what happened to Mona Turcotte's relative. She's been admitted to HSC after coming this time by ambulance.
Now she's in because she was passing out at home.
Jeff Keele, CTV News, Winnipeg.
Just minutes ago, Shared Health sent CTV News a response. In part, they say the challenges facing ERs have built up over years and can't be solved overnight, adding a lower wait time team is laying the groundwork for lasting change. As patients grow tired of long wait times, a record-setting 164 more physicians are practicing in Manitoba as of this spring than there was a year earlier. That's according to the College of Physicians and Surgeons of Manitoba, which released its annual report today. According to Doctors Manitoba, that net gain eclipses last year's record by about 30. However, it's raising concerns about the number of physicians increasingly being recruited from outside Manitoba, with grads from within the province making up less than a quarter of the new physicians. The data for the report was compiled at the end of April.